Though, let's shift focus and tell you about the World Health Organization. They have confirmed that 2 people in Ghana have died of the Marburg virus. The disease is highly infectious and similar to Ebola. For more on this, we're joined by Dr. Francis Kasolo, the World Health Organization representative in Ghana. Dr. Kasolo, thank you very much for your patience with us. So tests were conducted in Ghana and they came back positive that this is indeed Marburg, but you did further testing to satisfy yourselves in Senegal. Just to corroborate this, are you able to give us an update in terms of what those tests in Senegal have revealed?
Thank you very much for having me on the program. We are expecting the results from Senegal tomorrow, but I must add that the laboratory in Ghana that did the testing is one of our reliable laboratories. And so we will have the confirmatory test tomorrow morning from Senegal.
Thank you very much. We'll look forward to that. When we speak of Marburg, what are we talking about and what kind of symptoms does it present?
Well, Marburg is a killer disease, and as you rightly mentioned, it belongs to the same family as the Ebola virus. And so even the modality for spread is the same as Ebola, basically through direct contact with open wounds, body fluids like blood, saliva, vomiters, and urine, especially from persons suffering from Marburg. And in presentation, it's normally starts off with a very high fever and has a combination of symptoms, some of which include headaches, vomiting of blood, joint and muscle pains, and indeed bleeding from body openings such as the eyes, nose, gums, ears, and of course the skin. And also towards the end, people tend to have a reduced urine output.
This is the second case for West Africa, with the first being reported in Guinea last year. What do we know in terms of the numbers on the continent? Do we know where else we find Marburg?
Yes, indeed. As you know, Marburg is truly just an African disease, with cases having previously been reported in Angola, for example, Guinea, the DRC, and a number of other Central African countries, including in East Africa and Uganda. So it is really a disease that has been reported mostly in Africa.
Do we have an outbreak on our hands, or are we preparing for an outbreak? If so, what does that look like?
We are, whenever we have a serious disease like Marburg emerge, we encourage countries across the continent to heighten their preparedness, specifically ensuring that the surveillance for symptoms related to this disease are heightened, and that should they emerge any suspicious cases, that these cases are are quickly confined to health facilities, and that they are managed in a safe environment. So indeed, preparedness is a daily bread for all countries, and we encourage countries to really reach out and keep themselves informed on what is transpiring, especially in West Africa, Ghana, in relation to Marburg.
Sure. Does this preparedness look like travel restrictions at all?
Not at all. I think WHO is not recommending any travel restriction. Marburg can be prevented and are also managed easily as long as people follow the advice that we're giving. Specifically for prevention, we're looking at people regularly washing their hands with soap after touching suspected cases, ensuring that protective wear is used when attending to suspected cases of Marburg, and also avoiding contact of the dead bodies of those suspected to be died from Marburg. So indeed it is preventable, and at the moment WHO is not recommending any travel restrictions.
Are there any vaccines or antiviral treatments?
Unfortunately, no. At the moment, Marburg does not have any vaccine or proven antiviral for the management. What we are doing is basically symptomatic management of the cases and ensuring that the fluids given to the patients, and the temperatures are monitored and managed. So at the moment, no, we do not have any vaccines or antivirals.
Dr. Francis Kasolo is with the World Health Organization. He represents it in Ghana. Thank you very much for your time.